So, quick one on do GLP-1 medications work without exercise? In short, yes, they do work in terms of getting you to your goals and in the short term. The flip side to that, the double-edged sword there, is that it's much more likely those results are not going to remain if you don't make any of the underlying habit changes that you would want to make, whether you are on the medications or not. It's like most things in life, if it feels too good to be true, it probably is. The best way to use these medications, such as Ozempic, Mounjaro, Zepbound, all those out there, is you want to not only start taking the medication, if in lockstep with your doctor, that is the best approach for you and your health and reaching your goals. You want to implement an exercise routine and nutrition changes and habit and lifestyle stuff like stress management, improving your sleep, so on and so forth. You want to make those changes whether you were, as if you weren't on the medication. Like, you want to make changes to that. Those changes alone could get you to this weight loss goal, whatever it may be, whether it's you're looking to lose 10, 15 pounds, or if you're looking to lose 50, 100, 200 pounds. You would want to make all these changes as well, such as adding resistance training, even if it's just body weight training. Twice a week has been shown to be plenty for getting you to where you want to be, and over time giving you all the health benefits that you want. ACSM just updated their for the first time in like 17 years their resistance training guidelines or whatever. They basically showed like it doesn't matter what you do, as far as like reps and intensity and everything like that in terms of resistance training, even just body weight. You want to do it twice a week. You want to challenge yourself roughly to 80%, and you just want to do it week after week. What matters more so is consistency, not modalities or styles or anything like that. So implement something like that, whatever works for you. Make it fit your life. Get a lot of pushback on clients when we first start with them, and that's why they come to us, because they feel like it's impossible to fit into their life, and they're holding themselves to a much higher standard than they need to. They think they have to dive into like a bodybuilder's routine or a professional athlete's routine as far as strength training and exercise. That's not remotely the case. They just need to do something they can do week after week and fit into the busy lifestyle of being a mom, of being a busy professional, and whatever else life is throwing your way. It's just not possible to do what a professional athlete does on top of the life of all those things going on. So in short, can you hit your goals without exercise and just purely being on the medications? Yes, but those results will not last, and you'll find yourself right back to square one on January 1st, along with the rest of the resolutioners. If you don't want to do that, implement exercise and nutrition on top of starting the medication. Bring them together, help them work together, and you'll be able to keep those results that you worked so hard for and spent a lot of money on, probably, on the medications.